Hello everyone, I'm Dr. Saurabh Dixit, a consultant laparoscopic and robotic surgeon from New Delhi. So today I'm going to address a very simple but important question which a lot of students ask me, and since now the exams are over and many of you have cracked the rank and got a good rank and now you are planning to pursue surgery as a career. So there is a gray zone when the students are confused between whether to go for DNB surgery or whether to go for MS surgery. There are a lot of students who keep on asking, sir, whether DNB is good, or if at all we go for DNB, from which institution we should be going, what are the important things that we should be actually looking for, and which college to be selected in MS, and all these questions I'm going to answer today. One very simple and holistic approach of the surgery is that surgery is a skill based subject. So whenever you are choosing this branch, you have to understand that you have to choose a center from where you gain something. Now, when I talk about gaining something, you have to understand that the institution which you are choosing should have a balance between the academics and the surgical caseload. Because if you go to an institution where you get a very good caseload and you get no academics, it's useless. You may be very happy that you get a lot of cases to do like laparotomies and cholecystectomy, but it's of no use because the quality work is not there. Because learning is very comprehensive, and these 3 years are the most important phase in your life when you learn a lot of things. So one very important thing that you have to keep in mind is that choose a college which has academic activity, because surgery or masters in surgery doesn't mean only learning how to cut. It is what to cut, when to cut, and when not to cut. So students, you have to have exposure in all the fields, and that is why all the tier 1 cities are good options. I'm not going to individually number it. All the tier 1 cities are good options. Now, when we talk about the central institutes, they are always the best. Why? Because you have all the departments and you get a lot of exposure. When you talk about exposure, you actually tend to understand your own composure also. Whether you're interested for urology, whether you are interested for neurosurgery, whether you're interested for surgical gastro, you'll not even come to know until unless you're not exposed to them. So basic exposure of all the specialties should be important, and that is why you should be choosing an institution very, 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 very wisely. Now, when it comes to surgery versus DNB, one very important thing that is that MS surgery versus DNB surgery. One very important thing is that MS surgery should always be the preference. It's always, always, always. Why? Because generally, majority of the DNB institutes, they don't have very good facilities. They take admissions, you take admissions, and then you're all frustrated. Why? Because there is not a driving force. They're not interested in you. Rather, you are interested in the branch, and that is why you have come to their institution. Now, one big problem is that there is no academics. Remember, surgery without academics is learning butchery. You will not understand when to cut, when not to cut, and the composure that you should be getting from the branch is messed up. So there are institutions where DNB is very good. That institutions we have RML institutions like RML institute, all the central institutions of railways. Surgery is really very good there. So DNB, even DNB surgery there, I can confidently say that is good. So whenever you are choosing DNB, always remember choose either in the medical colleges. There are some medical colleges like Sikkim Manipal is there. Then if you want to choose DNB surgery, choose it in railways, choose it in central institutes. Whenever you go for this DNB, do go to that institution, take out some time, make a list, visit those institutions, talk to the seniors who are already present there, that what is the case scenario. Student, just you want to get rid of this preparatory phase, and forcefully you are forcing yourself into this DNB. This is not right. Surgery is a skill based subject. If you don't get any hands on, or if you don't get a good academic exposure, it's of no use. So it's better to drop and prepare again. Institutes like the branches like pathology, radiology, biochemistry, you can close your eyes and go to the DNB institutes, because there it is the machine based learning that you have. So patient exposure and direct patient interaction is not that you get a lot of work to do and you actually see a lot of things. So doing radiology from any good DNB institute, it's always a good option, but it's not the same for the surgery. So in surgery, MS versus surgery, always I will say prefer to go for MS, even though if it is in a private college, private institution. The second thing is that in DNB, there is a lot of motivation needed. I'm not saying that the pass rate is not good. This question is absurd. Pass rate is good because you have to prepare yourself. The only thing that you need to understand, you have to be prepared in this phase of DNB. You cannot go blank. Like in MS surgery, if you are a bit weak, also you get a push from the department. Okay, he's my kid, and we'll try to push him and get him passed. But there is no such motivation of the, you can say, consultant to get you passed in the exam, because finally they cannot involve themselves. You're doing DNB in a institution, you're going to totally remote place to give your examination, so you have to have that competency to complete that exam, and that is good also. The second thing is there is no difference once you complete DNB versus MS surgery, because ultimately in market you are accepted as a surgeon. If you are appearing for MCH, no difference, no difference in job cadre also. But yes, the satisfaction that you have with MS is quite more than the DNB, because you know confidently that yes, you have seen, you have done that level of residency and hard work. So DNB versus surgery, I'll always prefer to go for surgery in a private institution or in a government institution. When you're choosing the surgery in, you can say, institutions, tier one city should be the first priority. Try to choose the center which is near to your home, because you don't get a lot of time during the residency, and that is a time when you often try to miss that personal life of yours. You want to go to home, and suppose you are in Kerala and you live in Delhi, it becomes very difficult to commute. And suppose you live in Delhi and you take the branch in college in Rohtak, it's very easy to come on the weekends also, because we actually need a support after a time. One very important thing is, whenever you are choosing surgery in any MS institute, always see whether the seat is permitted or recognized. Prefer to go for recognized seats, not the permitted seat first. If at all you are taking permitted seats, take in the state where you have to actually practice or you belong to. Why? Because permitted seat, more or less over the time, they will be acknowledged at the as the permanent seats. But it, until and unless they don't get recognized, there are a lot of states who create a problem when you migrate to them, and they don't transfer you that medical registration in their states, just because that seats are permitted. However, with those permitted seats, you can confidently work in the state where from where you have done this. So if suppose you are in UP and you take a branch surgery and you take even the admission on this permitted seat, it's not a problem, because sooner or later you have to settle down in UP, and by the time that seat will get settled. So I'm not going to extend this video. Two important things. MS surgery is always better than DNB. DNB is not bad option, provided you choose it wisely. Otherwise, it will be a mishap or a tragedy for you. Choose it in the central institutes, choose it in the big national institutes, choose it in the medical colleges. Don't go for the small names, because they're not going to give you anything except frustration. The second thing is, when you are choosing the surgery as a branch, try to prefer good academic based institutions, because that is the only time when you are going to learn. So students, I was very descriptive in this differentiation between MS surgery versus DNB surgery. I hope my video would have helped you in understanding the differences, and would be very helpful when you are planning to opt for the branch. So all the best for the counseling, and I hope I could make some difference. Do subscribe to my channel, do like and comment and share it.